All right, you're welcome back, and we're looking at, well, the pharmaceutical industry and how the recession is affecting that all-important sector of the Nigerian economy. A group of Nigerian pharmacists are lamenting the worsening situation in the healthcare sector due to the effect of the recession.
Now, they want the government to do something to avoid an imminent breakdown. Correspondent Ohuabunwa completes the story now.
The president of the Pharmaceutical Society of Nigeria, Ahmed Yakazai, noted that the continued depreciation of local currency is gradually grounding the sector to a halt unless government takes urgent steps to address the situation. Yakazai explained that most drug manufacturers in the country have exhausted raw materials meant for production, and the need to source for forests at between 28 to 30% interest rates.
No raw materials to produce. They are paying salary without any activity. What do you expect? So they have to really scale down their activity. Some have already shut down, to be honest with you. The importers, they cannot access forests. They spread money all over the banks, but they couldn't get it. We understand the government has already directed CBN to prioritize forests for manufacturers. But we are saying, look, government should consider pharmaceutical sector because it's a priority area.
The pharmacist called on the federal government to resist past mistakes and errors in dissolving health boards. He pointed out that whenever boards of parastatals are dissolved, they stall disciplinary procedures.
To avoid unilateral, unpalatable discourse, the Pharmaceutical Society of Nigeria has since recommended its representatives to the Honorable Minister of Health as provided for in Section 31F of PCN Act. We have hastened to remind the federal government that Section 1 of the PCN Act provides for perpetual cessation, which ordinarily should exclude the PCN from recurrent dissolutions alongside other boards of parastatals.
The Pharmaceutical Society of Nigeria, however, called on the federal government to immediately appoint a chairman for the Pharmaceutical Council of Nigeria, as well as make qualified appointments among suggested names for the position of the Director General of the National Agency for Food and Drug Administration and Control, NAFDAC. Oluwatoyin, Abotibisi News, Lagos.
All right, with us in the studio is a former chairman of the Pharmaceutical Manufacturers Group, Sam Ohuabunwa. It's good to have you join us, Mazi.
Thanks for joining us.
Good morning. Right.
And also joining us from our Abuja studio is the president of Pharmaceutical Society of Nigeria, Ahmed Ibrahim Yakasai. Good morning, sir, and thanks for joining us on the show.
Good morning.
Okay,
Good
so
morning. How
yes,
are you?
Very well,
we're
thank
fine.
you. So we're looking at the impact of the recession on the pharmaceutical industry. Let's start with you, Mazi.
Yeah.
How really, I mean, it's a no-brainer. How has this recession affected the pharmaceutical industry that practitioners are, raising the alarm that if something is not done quickly?
I think the alarm is justified because after air, food, I believe the other very important need of man is medicine. And when that supply stream is threatened by what we have now, then there's a need to shout before it gets out of hand. You talk about food sufficiency. One of the things you should talk about is medical health sufficiency. And the way it is affecting us is in 2 or 3 ways. First is that because of the nature of the pharmaceutical industry, most of the raw materials are imported because we've not yet developed our petrochemical and primary API manufacturing facilities to be able to make the starting blocks, the raw materials. And so we have to depend largely on imported raw materials to then compound and manufacture. And with the scarcity of foreign exchange and the rationing that we find, many pharmaceutical companies are not getting up to 50% of what they need, some less. I serve on the board of a company that put some requests in September last year, and I speak to you that order has not been fully supplied in terms of LC availability for foreign exchange. The effort being made by the CBN asking banks to allocate preferentially to manufacturers is not getting to the pharmaceutical manufacturers up as I speak to you. So that is one real issue. And within that context of this problem, you're also having a situation where there seems to be a preferential opportunity for those who have some other means of bringing the finished products in the country, especially because of what they call the CET, which now makes the importation of finished goods cheaper than what you do locally, because CET allows zero duty, whereas some raw materials attract 20% to manufacture. So there's a disjoint. That in itself may be killing local. It's a disalignment, appropriate disalignment, and we've been speaking about this even before the recession. So recession due to no raw materials, as my president just spoke, and then the CET disequilibrium, where it seems that it's better to import. So some people who have money outside are using it to bring cheap drugs. So that seems to even worsen the situation. But however, overall is that the drug supply in the country is compromised right now. And I think it calls for an emergency response.
Okay. Let me come to you, Alhaji Yakasai. Mazi Ohuabunwa just made a statement now that the supply of drugs into the country is compromised one way or the other. And if we see from the layman's perspective, that's talking about, also deductively, we can say there's a lot of fake drugs in the system. Now, your society is one that looks into some of these things, even though you're not NAFDAC. But give us a perspective of how bad the situation is right now on ground presently. If we have to narrow it down to the specifics of what's really going on, how bad things are.
Thank you very much. You know, pharmaceutical industry is very critical when it comes to well-being of people and quality of life. And indeed, we are really aware that recession leads to instability as far as financial aspect is concerned, and it brings about so much fundamental changes in the economy, which means we have to embrace changes as far as pharmaceutical business or sector is concerned. But you know, as I've said, it is for the quality of life. And we found out that we are talking of providing safe, affordable, accessible, quality pharmaceutical products to people. And unfortunately, when you are talking of recession, you are talking of decline in the supply of forex. You are talking of inaccessibility to the money that at a very good rate that you can import the raw materials and the finished product. And unfortunately, pharmaceutical sector is import dependent. We depend on what to bring, either the raw materials, because we don't have the petrochemical industry in Nigeria where we can source all our raw materials. So we have to go into importation of active pharmaceutical ingredients. We have to go for even the finished products. We have about 5 levels. First level, you are talking of importation and distribution. Then you are talking of some packaging and leveling of bulk pharmaceutical products. You are talking of those importing active pharmaceutical ingredients to formulate and bring manufacture pharmaceutical products in Nigeria. And you are talking of even manufacturing of active pharmaceutical ingredients and come down to research and development. And we see it as a social service. We need these pharmaceutical products on the ground to really allow people to have safe and quality products. But unfortunately, when the issue of recession came in, we have been calling for the government to see pharmaceutical sector as a priority. Give it that critical look to know that yes, we are not after profit. We are in a different world. We are not necessarily talking about GDP. because GDP is just talking about production output and consumption. They are not looking into the human pains of what you can provide. So I ask for at least, because parallel market, if you bring drugs using parallel markets, the price will be terrible. Double, sometimes 90%.
Indeed, and you know,
So
let me come in
we
here,
are saying,
Mr. Yakasai. The PSN, the Pharmaceutical Society of Nigeria, which you represent, and MAN, actually, you know, first alerted the nation in February that there might be a rise in deaths, you know, as a result of upsurge in diseases, health complications, and all of that. Are you saying that government has not done anything since you first raised the alarm? And what are the implications of this?
No. You see, we thank God, the government, we have bad debt. So many companies supply the government and they have not been paid. But the government has already started paying, and they promise to patronize locally produced pharmaceutical products, which we feel if they do that, because our aim right now, the capacity utilization reduced from 35% to almost 20%. And mark you, we are manufacturing almost 78% of pharmaceutical products in the West African zone. And our intention is to make Nigeria as a hub for at least West African coast, if possible, the whole Africa. But definitely we need incentives. We need pharmaceutical intervention funds. We need pharmaceutical expansion grant. We need a window that we can be able to source forex, that we can make life ease in doing business. But definitely we are out to confront recession. We are not saying everything should be on the table of the government. Even ourselves, that is why this our conference, we are looking at the contributions of pharmaceutical sector in national development. That is why I came up with strategic plan of action to see how do we now talk, how do we collaborate, how do we bring investors from home, not necessarily from outside Nigeria. We need to have homegrown investment so that together we can all pool the resources and see how to confront recession. We cannot be waiting. Of course, I know there is problem of infrastructure, there is problem of high energy cost, there is problem of high interest rates, so many internal and external factors, you know, inhibiting the growth of the sector. Almost we have about operational value of $2 billion, 2.5 to 2.5 billion dollars. But definitely the government has a role to play, the industry itself, the people, the business community. We all have to come together and remedy the situation, and it has to be fast.
All right,
it's a social service.
All right, Alhaji Yakasai.
Yes, everything government must do.
Yeah, we'll come back to you on this. Now, let me come to you, Sam, even though we'll be going on a break for the news update shortly. But we know that Nigeria has a peculiar economic circumstance right now, from the recession they talk about and so on. But how ideal is it to engage government in solving this kind of situation right now?
Well, I think it is important to engage government, because at the end of the day, government has a responsibility to ensure that the people of this country are protected in different physical protection, and also protection in terms of their health, in terms of food, and all that. It is critical. And so government has a primary role, but also the industry also must first make the move, because I appreciate that the government has so much to deal with, and you have to compete with other sectors of the economy that also need funding and can also claim their importance.
Okay.
So that engagement is ongoing.
All right, we'll come back to you still on the engagement and knowing how to engage and how best to get results from there.
So welcome back. It's TVC Breakfast. We're looking at the impact of the recession on the pharmaceutical industry. And practitioners say if something is not done as quickly as possible, things may not look good in that sector. We have President Pharmaceutical Society of Nigeria, Ahmed Yakasai, is in our Abuja studio, and he's been talking with us. And of course, in the studio is Mazi Sam Ohuabunwa, former chairman, Pharmaceutical Manufacturers Group in Nigeria. You were trying to make a point earlier on how important it is, for your organization, for example, or the pharmacists to actually engage government.
Yeah.
Beyond engaging them, what exactly are the things you expect government to be doing?
Well, we believe that every nation must have priority at each time, and especially when you come to where a particular component of the economy is scarce. Today we have scarcity of foreign exchange.
Yes.
So we're saying prioritize in a manner that does not necessarily deny other sectors, but ensures that, there are certain things you can do without or you can defer. But a man who needs to take an anti-diabetic medicine and he doesn't take it because the product is either not available or the one that is available is too expensive or you cannot guarantee the quality, you have put the life of that person at risk. And I don't think there's anything more important than life. So that's the point the industry is making. The government should give some priority to allocation of foreign exchange. Government should give some priority to even in the area of purchase, because some of the other hidden problem is that government needs to support the industry.
What do you mean in the area of purchase?
In buying pharmaceutical products locally made.
Okay.
Yeah, there are some products, in the spectrum of product scarcity, you have some products that are still available in large quantities, while the government also needs to have a policy that continuously supports the patronizing local industry. That in itself creates additional impetus. And also we believe that one of the things the industry is pursuing and different segments is production of natural products. Just you spoke about ginger a few moments ago. There are products that come from our natural flora and fauna. Some companies and some pharmaceutical groups are going into that. That was why government set up the Drug Research Institute in Abuja, Pharmaceutical Drug Research. The funding has been a little bit unsteady and insufficient, but private sector is coming into that place now. And I think that government needs to give support. We have a number of companies that are into formulating phytochemicals, phytomedicines, getting medicine from local sources. That therefore takes away the need for importation and foreign exchange. So that is supposed to support the production of the allopathic medicines that we do. That's a section that the industry is developing and participants, and we need government support because research and development, you cannot do it with money from the 90-day money from banks. You need long-term funding. And that's the area we also dialoguing with government to support.
All right. Before we go to Abuja, let's get this foundational information. Now, fake drugs are a global public health problem causing death, disability, and injury. The World Health Organization defines fake drug as a medicine which is deliberately and fraudulently mislabeled with respect to identity and or source.
Counterfeiting can apply to both branded and generic products, and counterfeit products may include products with the correct ingredients or with the wrong ingredients, without active ingredients, with insufficient active ingredients, or with fake packaging. About 100,000 deaths a year in Africa are linked to the counterfeit drug trade, according to the World Health Organization. Now, the types of drugs that fall easily in this category are cough syrups, anti-parasitic and anti-malarial drugs, antibiotics, and even contraceptives.
Nigeria is Africa's largest drug market, and over 70% of its drugs are imported. Fake drugs come from a number of places, but findings from the National Agency for Food and Drug Administration and Control, NAFDAC, show that the bulk of fake drugs come from lesser-known factories in Asian countries like India and China.
Now, the 30% produced locally are also manufactured with imported raw materials. Presently, the health sector is experiencing shortages of supply of drugs. Essential drugs needed for high blood pressure, cancer, and others are not only expensive, but also scarce. Now, this is because of the high foreign exchange rate and the sliding value of the naira. Imported pharmaceutical products have been hit by about 20 to 25% price hike.
The extra cost incurred during importation is transferred to the consumers. Now, pharmacists are worried that this may lead to resurgence in the mass production of fake drugs. The high demand for medicines and low cost of production prompts counterfeiters to produce fake drugs.
According to NOI polls, 18% of Nigerians have personally been victims of fake, counterfeit and substandard pharmaceutical products, medicines and drugs. Independent pharmacy chemists 68% and drug hawkers 14%. Now that's another group that really need to be taken out, banned completely. They've been identified as
that's your opinion anyway.
Well, I'm sorry. Two main points of purchase of fake drugs, medicines in Nigeria. Remember the Molways?
Yeah, exactly.
One medicine cures everything.
Cures everything. That's. Now, some of the challenges affecting this sector include high interest rates imposed on manufacturers, lack of policy implementation of policies, high demand of drugs, and low supply, counterfeiting of NAFDAC numbers, among others. All right, now, this takes us into the issue of fake drugs. But before we come to you, Alhaji Yakesai, let's go on a break, and then we'll come to ask you some questions regarding this. All right, if you're just joining us, you're watching TVC Breakfast. We're discussing the impact of the recession on pharmaceutical products production in Nigeria, the challenges they are facing. And we have with us in the studio Sam Ohuabunwa, and we have in our Abuja studio Ahmed Ibrahim Yakesai, who is the president of the Pharmaceutical Society of Nigeria. Right, Haji Yakesai, let me come to you on this. We gave out some information earlier on that had to do with a lot of counterfeiting, a lot of fraudulent, a lot of substandard production of pharmaceutical products and so on. Now, you've talked about, even in the report we played earlier on, you talked about inability of accessing foreign forex to get raw materials and so on. Now, with the circumstance or condition we find ourselves now economically, how does it compound the proliferation of fake drugs on the counters?
Yes. You see, when you go to some warehouses now, I can tell you, you can even play football in the field. Wow. And unfortunately, even God abhors vacuum. Where there is vacuum, some criminals may likely try to fill the vacuum. This is a situation where if you have scarcity of drugs, some criminals can go deep, either imported or locally, to peg all the pharmaceutical products by changing the expiry date, by even putting something that's nothing inside. You see, you can have substandard, you can have superiors, you can have falsified, you can have falsified level, and you can have counterfeit, you can have clone products all together, because there is no availability of genuine products, and people really need to take the product, and it is not available. Again, not only packing, so many people are resorting to herbalists, babalao, and so on. So it is really pathetic that once there is scarcity, you are sure of packing to thrive. And we have been trying to fight fake and counterfeit drugs in Nigeria. Even we have been talking of how do we now review the law to make it stiffer. But you see, as you do this, you build one block, 2 blocks are trying to come down. So surely, after food, then pharmaceutical or medicine is the next thing. If you are talking of national security, pharmaceutical or medicine is part of security.
Indeed.
So definitely, as we are saying, the priority after food, medicine should be the next thing to be given, because we are talking of the well-being of the people. We are talking of the quality of life. We believe in giving health care definitely holistically, so that you can have healthier lives. So, but now, unfortunately, those who can access forex through the parallel market, if they bring it, the prices are so skyrocketed. The common man cannot afford it. Last time I tried to buy one product, but the way I see, even the increment was almost 90% of what I used to buy. And the purchasing power is also down. People cannot afford to buy because some have been laid off. Some industries have been shut down. Some they are producing at a very low capacity utilization.
All right, Alhaji Yakasai, yes, thank you so much. Thank you so much for the picture you've painted there. Mazi Sam, I mean, the question I want to ask you is not to make, you know, Nigerians really afraid there. But I'm just wondering, which categories of drugs really, you know, may be affected, especially when it comes to these fake drugs. And there are reports that tuberculosis, for example, is on the rise in Nigeria. Malaria has always been with us, continues to be, you know, spiking. And of course, HIV drugs and all of that. How is all of this, you know, playing out? Whether the non-availability of the drugs or the faking of the drugs, and how is the PSN collaborating with NAFDAC?
Okay, I think that you see the way fake drug manufacturers act. I mean, because I've dealt with them from the 1982 when I had the first encounter. I was group sales manager for Pfizer at the time. I encountered fake drugs then, and I understand how they operate. First is that they look for a product that is popular. They look for where there's a gap in the market. Because in about the 2003, 2006, pharmaceutical production went up and we got up to 50%. Today we're speaking about 30, 35, 40. We got up to 50% local production. I knew about that because beyond being chairman of the Pharmaceutical Manufacturers Group, I was also the founding chairman of the West African Pharmaceutical Federation, WAPMA. And so we studied factors that promote prevalence, popularity of medicine, gap, then the strength of enforcement by the regulatory agencies, and fourthly, the level of enlightenment of the people. And all that was going on. So today, they're looking, if you're looking at areas that will show much interest, they will look at anti-malarials, they will look at antibiotics, and they're also veering into products for treating chronic illnesses like anti-diabetes and anti-hypertensive. That's the danger. Way back, it was just like cough syrups or common paracetamol and all that, but it's gone. They're going to antibiotics. They're going into both the quinolones and the beta-lactams. They are going into anti-diabetics and anti-hypertensives, and nothing seems to be out of their reach right now. First is because of technology. Second is the ease with which they can bring in the fake products because of this tariff differential that allows you to bring free finished products for zero duty, and that is an issue. So I believe that we need to ramp up first production. Production will be ramped up by availability of the inputs through importation, through local development. Then secondly, we can ramp up production also through differential allocation of foreign exchange and also promotion of local patronage. Because, you know, if I'm producing and that product is being bought, I am encouraged to go do whatever it takes.
So what is NAFDAC doing in this case? I mean, it's always been their job to check fake drugs in circulation.
NAFDAC, like any other institution, you know, goes through periods of very excellent performance and then periods of not too. But what is even worse is because there's no confirmed leadership in NAFDAC.
Right now.
Since Dr. Irhi was removed, we don't have any DG. So those who are acting are acting, and there's the limitation of power when you are acting, and you don't know when the power will be withdrawn and all that. So I think that the regulatory agency needs to be strengthened. We need to also get the PCN. PCN is also a regulatory agency that manages the profession of pharmacy. NAFDAC looks at medicines, but the profession, which includes everything, is managed by PCN. We don't have a board. We don't have a chairman. So many regulatory and disciplinary actions cannot be taken against even professional misconduct. You know, so I think that those are areas which I think our president, Alhaji Yakasai, is working on to make sure that we get leadership for NAFDAC, leadership for PCN, so that if the regulatory agencies are working, they can then work well with Pharmaceutical Society, work well with Pharmaceutical Manufacturers Group, and all the issues can be addressed. And when you talk about this dialogue I was speaking about, it becomes more meaningful. When the industry with its regulatory agents confront government, they are more willing to respond.
Okay, thank you very much. Let's get to Alhaji Yakasai here. We don't have all the time, but what is the way forward now? Because we are here where we are. What's the next step for you, and what's the next step for Nigerians when it comes to availability of drugs and what we have on ground right now? What's your advice?
Yes, number one, I think immediately the government should establish national strategy and action plan for pharmaceutical manufacturing companies. Immediately to come and sit down, discuss holistically, so that we can build shock absorbers. It's not necessarily that, you know, since 1975 we have been having recession going on and on, but we should have to address this issue where we can make pharmaceutical industry in Nigeria a hub. Then, secondly, the patronage, I said, because 4 companies have already qualified for World Health Organization GMP, and 16 companies are now in the process. And it means a lot of money. After spending money and no patronage, it's a serious problem. Again, those who have supplied and have not been paid, they should immediately be paid. And definitely, we're happy to say that Dangote Group is coming out with petrochemical industry, where we can have all the raw materials.
All right.
Without petrochemical industry, we will continue to be import dependent.
All right. Alhaji Yakasai.
That kind of thing. We need the petrochemical industry.
Okay. Yes. Alhaji Yakasai, thank you very much for talking to us right now. That's the much time can permit us. Alhaji Ahmed Ibrahim Yakasai is the president of the Pharmaceutical Society of Nigeria. Thanks for talking to us on the program. And Mazi Sam Ohuabunwa, thank you very much for coming on the program.
Thank you.
It's really good to see you.
Pleasure, always.
Right.
Thank you.